Welcome to the Future of Wellness, exploring self-transformation and holistic healing to unlock your inner potential. Hosted by Christabel Armston and Keith Parker. Hello and welcome to this episode of the Future of Wellness. Today we are joined by Bryant Meyers, a best-selling author and leading expert in the field of energy medicine and PEMF therapy. He's also a former college physics and math professor. For over 25 years, Bryant has researched, tested, tried, and investigated energy medicine devices, researching them thoroughly and studying with many of the world's leading experts. During the past 16 years, Bryant has dedicated his research to PEMF, that's Pulsed Electromagnetic Field therapy, because he feels it is the most effective and best researched energy medicine device available today. His groundbreaking book, PEMF, The Fifth Element of Health, is a consistent bestseller in its field and has sold over 100,000 copies worldwide. Bryant has been featured on Gaiam TV, Hay House Radio, The Brian Tracy Show, and aired on various CBS, NBC, and Fox stations across the country. Currently, Bryant is a faculty member at Quantum University, where he offers courses on energy medicine and PEMF therapy. Welcome, Bryant. It's a pleasure to host you here today.
I'm glad to be here.
Can you explain what PEMF therapy is and how it works?
Yes, PEMF therapy actually is very natural and all around us. The Earth's magnetic field actually has frequency vibrations to it. So PEMF stands for Pulsed Electromagnetic Field Therapy, and it's actually magnetic fields that change with time. So we're all familiar with like little bar magnets or refrigerator magnets, and we've probably all seen like in high school, like a bar magnet with little iron filings around it where you can see the field, right? So those were the magnetic fields being kind of highlighted by iron filings. And so that field, that's a static field in a magnet, right? So now imagine taking that static magnet, now pulsing it, like vibrating it. Now you got a PEMF, now you got a time varying magnetic field, a magnetic field that changes with time. And it actually has much more dynamic healing effects in the body, as we'll talk about today. But these magnetic fields are actually not only healthy and therapeutic, but they're essential for health. We need them just like we need water, oxygen, food, sunlight. It's an essential. That's the thesis of my book, right? PEMF, the fifth element of health. That was my book title. So it turns out these Schumann resonant frequencies and these magnetic fields of the Earth, our bodies and cells need them or we get sick. Now, we take it for granted because even inside of a big concrete and steel building, we're still getting these magnetic fields because it's hard to block magnetic fields, very hard. But there's been really good studies with Valerie Hunt, originally with Rutger Weber, in his bunker study showing when you shield people in Faraday rooms, which are these big rooms that shield out the magnetic field, all kinds of problems happen. You get a disorientation, a dizziness. You get increased sensations of pain. You get kind of more of a depression feeling, like you just start to almost cry for no reason if you're in one of these rooms long enough. And the reason we don't experience that, because none of us lives in a perfect Faraday room, right? But those studies do highlight the fact that we do need all these natural, beautiful magnetic fields of the Earth. And again, we've all seen pictures of the Earth, right? With a big, kind of like a big bar magnet from North to South Pole, right? Well, that's not exactly correct. Because the magnetic field of the Earth does vibrate a little, kind of like a vibrating bubble. So the pictures in the textbooks look like it's a static magnet, like the Earth's some big bar magnet, but that's not the case. It actually vibrates. So it's a PEMF, a time varying magnetic field. And then that's coming from the core of the Earth. The dynamo theory is our best known theory to understand how the magnetic field of the Earth works, which is still not 100% known because it's a lot of unknowns, but that's coming from the core and wrapping around the Earth. Now, from above the ionosphere to the surface of the Earth, there's a cavity, and this is a resonant cavity. And so with lightning strikes, like 7 million lightning strikes around the planet every day, it kind of rings that cavity like a bell. And so you get the Schumann resonant frequencies coming from lightning strikes and the geometry between the ionosphere, which it's almost like you can think of like a soap bubble layer around the Earth. It's like and this is why shortwave radios can work around the Earth, right? Because you can bounce or skip those radio frequencies off the ionosphere. So the ionosphere kind of creates like this top layer, electromagnetic sort of conductive layer, between the Earth, and all the lightning strikes create these Schumann frequencies, and these are PEMFs. You've probably heard of it, you being in all the energy devices and stuff you're into, you know about the Schumann resonance, 7.83, right? And then 14.2, there's many harmonics. It goes up to like even 50 hertz and it starts to go down quickly. But those frequencies have been, again, shown to be essential. Think about it, our brain state, our brain waves like alpha, 7.83 is right at a nice low alpha. If you're in a 7.83 brainwave state, your body's going to be really relaxed. I mean, that's like a meditative state even. So if we're connected to nature, these natural frequencies are very grounding, relaxing, therapeutic. And of course, people say, well, if we can just go and get PMF out in nature, why not just go lay out on the grass, right? And that's a good question. The problem is it's a twofold problem. The first problem is the average person spends 93% of their day either inside of a car or inside of a building. So we're just not getting that connection to Earth anymore. Number two, we're surrounded or bombarded by unhealthy PMFs, or I just call them EMFs to distinguish. And these are from your 5G, Wi-Fi, Bluetooth, smart meters, and that's the microwave high frequencies. Then you have the dirty electricity from the power company that are going to be kilohertz, low megahertz frequencies. Do you guys know about that? The dirty electricity that piggybacks on the power lines, and that all the appliances in your house contribute to that. This is why everybody should test their house for dirty electricity, and you can get filters to kind of mitigate that. But the point is that we're not only disconnected from the Earth by spending too much time indoors, we're surrounded by all these unhealthy frequencies that kind of bleed out or kind of drown out the natural energies of the Earth. So it's kind of like this, like having a nice Beethoven symphony playing, then you got heavy metal playing on top of it, right? So I mean, so using a PMF therapy device is a solution to this problem because it gives you these life nurturing essential energies. And so I don't know if you want to ask any questions on that because I can keep talking here.
Well, before we go further with how PEMF devices actually interface with the body and the cells, et cetera, and have a healing effect, just curious to know more about your background. How did you first get involved in the field of energy medicine, and what inspired you, given that you were in that world or that field, to specialize in PEMF therapy?
Yeah, actually, it started in 1995. I lived. This is where I was still finishing my bachelor's degree in physics at Georgia Tech. And, I was a physics major, right? So we had to do a senior research project. So it turns out I was living at the time at a healing retreat center with this lady named Elizabeth Short. And she happened to be one of the world's experts in radionics, which is a form of frequency medicine, right? In fact, she actually built these black boxes, these radionics devices, and she would treat people across the country, even they weren't even locally, with her little, it's a quantum entanglement effect, right? So you can treat people from a distance. And of course, this is all like being a physicist. I'm like, how does that work? And she specialized in animals. So I'm like, wait a minute, animals don't have a placebo effect. So this can't just be these animals, these dogs are getting healed. How is this possible, right? So I learned about radionics, which if you don't know, it's kind of a little more old school energy medicine, but it's essentially this big contraption with all these little dials. And it's got like a little metal plate that you can put either a Polaroid or their hair sample, or you can use them like their nails, anything that's them, right? And Polaroids are important because, it has to be, they seem to capture the energy of the person better than other types of photography. But she would prefer like hair samples was her kind of go-to. Was a dog, she'd get like their little bit of dog sample. She put on the metal plate and she was very good at dowsing, very intuitive. So she would douse this big book of frequencies and she would figure out which frequency that dog or that person needed. And you create like basically whatever disease that dog has there's a frequency signature to every disease. And this is the basis of homeopathy too, by the way. But this is a little different than homeopathy because what she was doing was creating through destructive interference, a frequency that was out of phase with that disease frequency. So you dial in and it's like an antidote. So you can't, kind of like noise canceling headphones. That's what they do, right? They're getting destructive interference that matches whatever sounds coming into your ear. You're doing an out of phase wave with that creates basically noise cancellation. So this is kind of disease cancellation technology, right? So, and I was very skeptical because I was not really yet on board with all the meditation and new age stuff that I came to love, but don't, after a while, but I couldn't deny the results. It's like, wait, animals don't have a placebo effect. It's like but quantum entanglement is a thing, so if you have somebody's sample, that sample of them is quantumly entangled to wherever they are, even if they're out in outer space, because the Russian space program did use Earth-based things. They kind of use this technology because they did a lot of things, but this was one of the many things they did. So that kind of just opened my world to energy medicine. I was so kind of excited about it. It's like, this is amazing. And that I did my senior research project at Georgia Tech with that. And I brought the big black box into my presentation with a room full of people, right? So I'm excited thinking people would love to hear about this. So it's like, wow, but what I was met with was maybe there was maybe one person in the audience that did like this. And then it was just quiet. It's like that didn't. And then the teacher that kind of organized that, he just kind of patted me on the shoulder. It's like, oh, it was a good presentation, kind of just trying to get my morale up a little bit. But I'm like, well, but what can you do? I mean, it was way ahead of its time. It's ahead of its time. It's still kind of a little ahead of its time, although it's not, because a lot of the stuff was known in the 1800s, early 1900s. People don't realize the Flexner report in 1910 kind of the big pharmaceuticals came in. They had all this electrotherapy stuff going back in the late 1800s, early 1900s. And it was like they were doing they were healing bones. They're using electrodes across a bone fracture and using currents to heal bones. It's like, and they were getting good results. So it's like, why did all that go away all of a sudden? Well, it was big pharma came in 1910. The Flexner report essentially made literally almost illegal, not quite, but almost illegal, using any electrotherapy method. And they kind of tried to make it like mesmerism, like it was some snake oil type of thing, even though there was all kinds of great research on it back at the time. But that was the rise of big pharma. And it took, and even Rife, came in the middle of this, you could say, this curtain of suppressing all these natural energy technologies. And that's why Royal Rife had such a problem, because the Flexner report was still in play. So he's like doing all this stuff with his frequencies. I think it was in the 40s and 50s, or when was Rife kind of in his heyday? Might have been the 50s. But he did one study with cancer and found 7 out of 10 people got healed with his Rife machines. But they just came down on him so hard, they just almost obliterated him into the ground. I mean, it was just because, again, you come out with a natural remedy for something that's so profitable for big medicine, big pharma, that you're going to have a target on your back, right? It's like they couldn't let that get out. So he suffered greatly, even though he just spent literally years under his Rife microscope just looking at. Now, it was in vitro, so people sometimes, I don't think Rife is the best form of energy medicine, although it's certainly valid if you know what you're doing. But you have to remember, Rife did use in vitro, so this is not always the same as in vivo in the body. So PMF and red light therapy, as two examples, have a lot more research than Rife does. Rife doesn't have that much great research, but I don't deny that it works. I stayed in a Rife clinic for 4 months and worked with many different Rife machines, so I know it very well, and I could see it helping people. It's just the clinical research is not as good as PMF and, say, photobiomodulation or red light therapy, which to me are the two best forms of energy medicine, just based on sheer research alone, in my opinion. So I got into it. That's kind of how I got into it. And then PMF specifically, I got into, because again, it was just kind of my passion, trying all these different energy devices, because I wanted to live, I wanted to be immortal. I'm just kidding. So it's like, but I realized, there's something in the 90s. I worked at GNC and I read this book by Sandy Shaw and Dirk Pearson on life extension, right? And I was taking all these high dose antioxidants in my early 20s even, because it's like, I don't want to die. It's like, I just had this experience with getting my appendix taken out where they put me under, and it was this weird experience of just being like a blackout. It's like, I was just like, where did I go? It's like, is this what death is like? This is before I became more spiritual. I was a little more atheist back then. So I just had this kind of desire to not die. Even though of course that's a futile quest, right? But yet, okay, well, we can, live as long as possible. So I, just trying to find everything possible so PMF of course, I stumbled across PEMF because it's one of the more popular forms of energy medicine. But the first couple of devices I used didn't really, impress me that much. But then when I used the Emerus, it was called I'm just mentioning this brand because it's what I used. But when I first tried the Emerus 2000, that's what got my attention because I noticed that night better sleep. I mean, I just slept like a baby and I had terrible insomnia at the time. So it just kind of jerked me out of my day-to-day routine. It's like, whoa, what just happened here? Because it was like that deep sleep where you got vivid, colorful dreams and you're just kind of like out like a, so it was very, 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 it contrasted to how I'd been sleeping the past couple of years. It was like night and day, no pun intended. I mean, so that got my attention. I'm like, wow, what is this? And I just started to research it. And the way I've done many other products, like I was into like this 3-day colon cleanse. So I was a networker. Like I've probably been in 50 network marketing companies now. So whenever I found a good product and that I really believed in, I'd be like, maybe I can do a business with this. Like, because that kind of starts with me. If I don't get a result, then I can't get passionate about anything. So I just started, people that I know would buy it and they got all these great results. It's like, wow, this is really working. I mean, some just life-changing testimonials, right? So that just kind of snowballed from there. I mean, once you start seeing it work for yourself and many other people, it's like, wow, what's going on here? I hadn't seen these results with Rife and some of the other devices I'd worked with, not to this degree. So that's how it all got started.
There's so many different threads there I could open up with you, Brian, based on what you just shared. I wanted to zoom out a little bit for the listeners because not everybody's familiar with what a PEMF device looks like, in a how to engage, what a treatment, let's call it, looks like, what's the process. So I wonder if you could talk a little bit about that and also break down the science somewhat around PEMF therapy, around how it's interacting with the body at a cellular level. What's actually happening.
I can describe that most people are familiar with like the mag chargers of Apple, the MagSafe. I think they call it MagSafe charger. So we all put our phones. I know you can't see this, but we put our phones on a charging plate, and we don't have to have it plugged in, right? It charges wirelessly. Or maybe you're familiar with your toothbrush chargers. You put your toothbrush in a little charging thing, and it charges up your toothbrush. But there's no wires that are like adding current. It's not, I mean, of course, you can plug your phone into the wall and charge it that way through direct current, but you can also charge it wirelessly with charging plates. So PEMF therapy devices are literally whole body battery charging plates or pads. And I was just kind of showing that image because if you're able to see or open up one of these little wireless charging plates, you're going to see a little PEMF coil. And it's the same coils you see in PEMF mats. I mean, literally the same coils. And so we are charging the cells, and batteries are cells and cells are batteries. We've heard of a wet cell and dry cell battery, right? It's kind of appropriate that our cells are called cells because they are little batteries. And so so basically PEMF essentially is wireless power transfer where we're charging our cells wirelessly through a changing magnetic field, okay? So when you swipe your credit card through a credit card reader, you have to swipe it fairly quickly. Why? Because the magnetic strip is a magnet and it's creating a little current to the credit card reader by Faraday's law of induction. This is called Faraday's law or slew rate. So one of the big strategies of PEMF is to have a high slew rate or a very quickly changing magnetic field, because the faster you change the magnetic field, the more current you induce in a wire. And again, this is just straightforward physics. In fact, the Faraday discovered this by putting a magnet through a solenoid and connect it to a little it's called galvanometer, but that just measures the current, right? So he was seeing a current in a wire just with moving a magnet over the wire. No battery, nothing plugged in. Just simply a changing magnetic field induces a current in a wire. And they almost discovered that by accident. It's like, wow, how is that possible? And of course, that's where Maxwell's equations eventually explained all that. But essentially, I call PEMF therapy a whole body battery charger because your 70 trillion cells, or 37 trillion based on what Google says, or however many cells we have a lot, are like little batteries that have a cell voltage measurable around 70 millivolts. So when you lay on a PMF mat, you're essentially charging up your cells, increasing ATP. One study showed up to 600% increase in ATP, which is kind of the little currency of energy in your cells, right? In fact, according to modern molecular biology, ATP is the main source of energy. Although there are newer theories by Dr. Gerald Pollack and water being able to store energy, but maybe might be beyond the scope of this talk today. But but the other way that PMF can work is through resonance coupling. So just like so not only can you transfer energy wirelessly by a changing magnetic field quickly, but you can do it through frequency resonance, kind of like the way your radio station transmits a radio station to your receiving antenna. That's a resonance matching. So energy is getting wirelessly transmitted over space through resonance. So with resonance now, we don't need a high intensity. You can have, so there's many, so I would say the two main categories of good PMF devices are the ones that focus on resonance and the ones that focus on high slew rate, which to create that induction. And actually a lot of the good ones do both, because it turns out a high slew rate signal has a lot of frequencies in it by default, which is a little complicated mathematics, but it's kind of cool that, so, but I've got a PMF system that's in the picotesla intensity. Okay, that's incredibly weak, because some people say, well, you need high intensity PMF. No, you don't. In fact, the Earth itself is very low intensity. So again, our bodies have evolved in these lower intensity fields, not high intensity. So that's kind of one of the myths of one we can talk about maybe a little later about PMF, is that you need more power. And Dr. Pollack's kind of the main proponent of that. But there's many others that teach that too. But there's a lot of flaws in that model, and we don't have to. We can see if we want to get into that or not. But it does lead people, to me, down the wrong path, unfortunately, right? So to me, it's the frequency resonance and the Faraday induction is the real science. And again, it's inducing healing microcurrents. So again, we can drill down deeper if you want into the mechanisms. But essentially, I just like to start with that big, it's kind of a nice metaphor. It's like a whole body battery charger. Powers up the cells, gives you more energy, and it increases through the Faraday induction all these flows, like meridian flow, nerve flow, blood circulation flow, lymphatic flow. It's like from head to toe, right? We have these fractal branching networks of energy flows from, because I think if you ever you've seen like your circulatory system, right? It branches and branches again, like a tree, right? You got this bifurcation. So those are fractals, right? Our body's full of fractals. And so PMF is opening up all those channels. And then one of the mechanisms that it does that with is nitric oxide. It stimulates nitric oxide, which helps to open up and widen the blood vessels, so your blood and lymph can flow easier. So it just gives you this, not only are you getting more cellular energy, you're getting better circulation through your body of blood, lymph, nerve flow, meridian flow, and even airflow. Nitric oxide opens up the airways so you can breathe easier, right? So to me, those are the two main mechanisms of why PMF works for just about everything. Because when you increase cellular energy and you increase microcirculation and circulation, I mean, wonderful things happen. And then on the other side of it, you can shut off inflammation too. That's another big mechanism. PMF turns off inflammation. And when you turn off or shut off inflammation, you turn on healing and all the growth factors and regeneration stem cells. But you have to turn off inflammation first, because inflammation is very catabolic. And it may be, according to some, the root cause of most disease. Or you can take that one level deeper, and it's the root cause. You can say mitochondrial dysfunction is the root cause of all disease. But the byproducts of mitochondrial dysfunction are inflammatory compounds like reactive oxygen species, and all the things that cause inflammation really a lot of times start in the mitochondria from, and there's a lot of really good research on that. Even things like cancer and Alzheimer's, heart disease, diabetes being mitochondrial dysfunction disorders. So PMF is like powering up the mitochondria, shutting off the inflammation, and then it reboots and stimulates regenerative pathways. And there's a lot of details in there we don't have to get into, but it's really cool. The research is very, very, we're talking over 30,000 studies in PMF and over 1,000 randomized control trial studies that rule out placebo. So in some of these mechanisms I'm just kind of scratching the surface on are very well researched. So they're not just theories, or they're not just hypotheses. I mean, they're they've been shown to be in multiple studies to be what's happening with PMF. So it's a great pain. I would say the number one reason people get PMF is for pain relief. But it's more than just like an opioid or a steroid injection. It's not only shutting off the pain, which it does, and turning off the inflammation, but it's stimulating those regenerative healing pathways to really and again, there's many studies on PMF increasing stem cells, like the neuronal stem cell study with NASA. There's many osteocyte increasing bone matter. So it increases stem cells in the bones to produce more bone. And even the joints, the chondrocytes, which are your joint cells, it stimulates stem cells and regeneration in the joints. Again, very good research to show it does these things. So that's probably the number one reason people get PMF is for pain management, but it does so much more, right?
A brief pause to thank you for listening to this episode. If you're looking to take the next step in your transformation, find out how we can support you with our popular energy healing training, one-to-one private sessions, free resources, and more. Visit energyfielddynamics.com to learn more. So speaking of that, you've just covered a lot of different things that people may generally be using it for, things like pain relief, inflammation, different kinds of ailments that the body may have. But what about when we get to more subtle things like spiritual development? You know, you've had some content produced around the idea that PMF enhances coherency and may even contribute to one's kind of journey to enlightenment or awakening. Could you talk about the mechanism that might underlie how PMF can contribute to those things?
Yeah, well, first of all, one of the things that it does, and studies have shown this, is it lowers cortisol. Like you can see like a before and after. There's been some studies on this, and then it's also shifting. It increases autonomic the functioning of the autonomic nervous system. So meaning most people are too much in fight or flight or fright, which is your sympathetic, and that's cortisol, adrenaline, all these stress hormones are at too high of a level in too many people in the modern world. And for many reasons. I mean, it can be psychological, emotional, spiritual, and sometimes just physical from the stressors of a poor diet or getting too much electrosmog or whatever it is, right? So that puts the body into a sympathetic fight or flight state. And that's a very tense, uncomfortable state to be in, and it's very unhealthy too. In fact, it constricts your blood vessels. You get an increased risk of heart attack, stroke. You're more likely to get cancer. All these things, and so because PMF is shifting the body into more of a parasympathetic, or again, it's creating balance, right? Obviously, you can get too parasympathetic. You get vegetative if you're too parasympathetic, but most people, the pendulum's the other way. They're just too stressed out in the modern world. And that's doesn't seem to be getting better. It seems to be a big problem. Stress is, along with inflammation, you could say, at one level, stress is one of the main reasons people get sick too. So when you can take your body out of stress, and just there's some studies with PMF showing that like there's a way to measure like the muscle relaxation effect. So it has to do with when your muscles are tense, there's like more voltage. And then with PMF, you can see the tension soften. So you can literally measure that. So as you know, with meditation and yoga, I mean, when you can use your breath or hatha yoga for postures, or just, just focus on, be here now, just focus on your mind or stilling your mind, you can kind of get into those states. But if your body is really stressed out, it's kind of hard if you sit down to meditate and you're all stressed out and all tense, your mind is just going to be going 100 miles an hour. It's going to be hard to meditate, right? So PMF to me is like an energetic hatha yoga in a sense, where it helps the muscles to relax and it improves blood flow, oxygen flow. Because again, if you don't have good circulation in your brain, you're gonna kind of have a little bit of brain fog. And with that brain fog, it makes it harder to meditate. You can't really get present on focusing on the eternal witness, you could say, or whatever word you want to use for the true self, right? And so that requires, a bit of, so obviously it doesn't take the place of meditation. So it's not going to help. It's not, you still have to know thyself, with the capital S. But But it can kind of just create like Hatha yoga. Hatha yoga is the same way. You can't get enlightenment just through Hatha yoga. Hatha yoga is just the bodily exercise that helps you to, Yogananda would say it helps the body to meditate longer and more in a more relaxed way. Because if you have aches and pains in your body, that's another thing. A lot of people have all this back pain and all these pains. So they sit down to meditate and they meditate on their pain because it can be so painful. Something like low back pain or neck pain can just be excruciating in some cases, right? If you got a slip disc or something, the nerve is pinched, it's hard to meditate, right? I mean, when you're really in that much pain. So it's good. So PMF kind of, you could say more indirectly helps you to become enlightened by just making your body kind of creates it's like the garden where you can meditate more easily, but you still got to meditate. You still have to, or if you're blessed enough to have just a spontaneous awakening, like the Dzogchen tradition, you don't always have to meditate even. You can just recognize the self and boom, there you are, right? But most of us need to meditate to make the odds this whole, well, anyway, it's interesting. I got a book half written on non-duality. And so, again, 'cause that's one of my favorite areas of philosophy and spirituality because the connections between that and quantum physics are just so amazing. But that's another talk for another day. But I do think PMF can indirectly help.
Expanding on what you're sharing here, Brian, I'd like to see if we can open this up into the traditional concept of the aura, right? The human aura or the biofield in relation to PMF therapies.
Oh, absolutely. Yeah. So and I actually have a whole video on the biofield because to me, it's and what's kind of sad is modern medicine actually can measure the biofield, but it still doesn't acknowledge it. Meaning, well, first of all, we know the body's electric. So it all starts there, and with as far as scientifically measuring the biofield, and this has been known since the early 1900s. EKGs and Hans Berger and measuring EEGs with brain waves. That was 1920s. So we know the body. See, the body electric is not some new age thing. The body is electric measurably, and modern medicine knows this, right? But even better, in 1962, I can't remember the name of the researchers, but they, for the first time, this should be in all medical textbooks, and it's not. It's sad that it's not. But they actually, for the first time, measured with very sensitive magnetic field detectors or sensors. They're called squids now, but before squids, that is what they use, like these little rods that have tons of windings that were just picking up the weakest magnetic field, right? But for the first time, they measured the magnetic field of the body, like at least a couple feet away from the skin. Okay, why is that significant? Because it's showing you that you are more than you go beyond your skin. You're measurably, you don't end at the skin. Your magnetic field, because the biofield is more than just a magnetic and electric field and biophotonic field. There's probably deeper soul levels of matter that we don't even know yet, right? Maybe string theory will discover one day, who knows? But certainly it measurably has a magnetic field component, the biofield, a measurable electric field component. And with photomultipliers, you can measure the biophotonic component like Fritz Popp has done. So this is not new age. This is scientific equipment that can measure these energies that extend now with modern squids. SQUID stands for superconducting quantum interference device. It's essentially just a long-winded word to describe a very sensitive magnetic field detector. And you have to be in a Faraday room in order to, because again, your magnetic fields of your body are in the picotesla range. So the magnetic field of the Earth will drown that out. That's why you have to shield the Earth, but then you can measure these frequencies. And what's really amazing is that when Zimmerman did studies with squids on energy healers, he was able to see the energies coming out of their hands were magnetic fields with frequencies between 0 to 30 hertz, which is the Schumann resonant range, right? But this is what really got me. I got almost goosebumps when I first read this. The peak frequency coming out of these energy healers was around 7 to 8 hertz, which is that's a Schumann resonance. So it's almost like these energy healers are conduits of the Earth's energy in the body, because again, we have magnetite in our body. This magnetite is like little tiny magnets in our body. So we can kind of tune into these very weak fields, and we can amplify the signals. And like with energy healers, they can amplify it more than the average person, right? So again, measurably, there's energy fields with frequencies coming out of the hands of these energy healers. And so again, this should be reported in medical textbooks. Of course, it's not, but it's sad because this gives a real scientific basis to Reiki energy healing, that it's a measurable magnetic field that has frequency to it. It's basically PMF. I mean, that's what PMF is, right? Now, there is a little bit more with energy healing because you have the intentionality and sort of a deeper, maybe soul consciousness, emotional, because there's probably layers to our biofield that science, not even this sophisticated science can detect yet. But it's probably more the etheric body, maybe, the lower astral. I mean, so I think science is able to detect some of these subtle bodies. I don't know if we're able to get to the mental body, causal body type of levels yet. I don't think science has equipment to get there, but we can reach those areas in meditation. That's areas that you can experience directly, but science, that's to me the kind of the cool new frontier of science, I think, will be ways like, what's his name? Thornton Streeter has this biofield viewer, and he's able to see the chakras in this biofield viewer, but it's a very sophisticated thing and you have to learn how to really use it. It takes a lot of training because it's not just like a clear, here's your chakras, like some of the paintings will show, right? Or the pictures. But it's there. And Valerie Hunt at UCLA also did studies with sound where she could kind of illuminate the chakras with different, very sophisticated sound approaches. So to me, that's kind of the chakras are getting to a deeper layer even yet. So I think there's still a lot of mysteries that what is that energy in the chakras? Is it, and I'm sure it has a magnetic and biophotonic and electric field component, but probably something more too. Maybe like a quantum theory of gravity will better explain that, perhaps, who knows. But so yeah, the biofield, but so PMF is working on the biofield. That's the thing. It's so again, because we are energetic, electric, biophotonic beings, again, these are elements that we're made of. So PMF is again like I call it vitamin P sometime for PMF, because you're getting that energetic electroceutical, right? It's like an electroceutical that's an essential energy element. Again, that's why my book is The Fifth Element of Health, because we typically know we need food, water, air, oxygen, sunlight, but we don't always realize that PMF and some of these other energies of the earth are also essential. I would say the walking barefoot and getting like the electric currents from the earth and the electric fields from the earth are also essential too. And another reason people get sick is they're ungrounded. They're not connected to planet Earth. So I try to walk barefoot every day myself. I mean, and my neighbors think I'm crazy, I think, but I like do my little mantra while I'm walking barefoot back and forth in my backyard. Because I want to do, I mean, I get a little mini spiritual practice in that, but then I want to get my bare feet on the ground. So again, that's a little different than PMF, because PMF is a magnetic field, like walking barefoot's little micro electrocurrents from the earth, because the earth has a negative charge. And again, negative charge is anti-inflammatory. So in one sense, the key of energy medicine, if you take the fundamental mechanism, at least at the energetic level, is really about electrons. In fact, Albert St. Georgi, I'm not pronouncing that right, but he's a Nobel Prize winner. Very hard to pronounce Hungarian name. I looked up 3 pronunciations and they all said it differently. It's like, you can't even agree on how to say it. Anyway, he was a genius. He was way ahead of his time in energy medicine. So he would say life is really the flow of electrons. It's like from cascading from higher to lower states. And life is driven by electrical flow. The body, again, the body electric, this energy, or you could say, the chi. It's like you can, some people try to equate like the electrical flows of the electrons and protons with chi or prana. And there's probably a connection there. Prana might be a little something more sublimated, but I do think that it does have an electrical component. So when we move, what PMF is like an energy healer, PMF is helping to move energies, to unblock blockages in energy flow. And those blockages can be literally a blood vessel even, right? But sometimes they're meridian blockages in the premovascular system, they've shown to be the hard wiring or the fiber optic network of your meridians is the premovascular, which is kind of close to the skin, right? So again, acupuncture meridians is very well researched, over 10,000 papers on acupuncture. So again, for people that are skeptical, it's like, well, the ancients have known about chi and prana, this subtle energy for several thousand years, at least 3,000 or 4,000 years. And same thing in India, the prana, they don't, it's a little different with the chakras versus the dantians and the Chinese system, but they're all essentially saying the same thing, that we have these major energy centers and we have all these little networks, the meridians or the nadis, they call them in the Hindu system. And these are the kind of, all these energy flows are giving us life. I mean, they're like a light bulb lighting up. Without that electricity, we're a light bulb with no light in it. We don't have any life. So I do think, again, there's probably more to it than just bioelectricity, but certainly if you don't have the bioelectricity, your body can't live. I mean, so PEMF helps to increase that energy flow. And like I said, it increases cell voltage, it increases ATP, it increases all these, you could say energy and fluid flows, because you have nerves and meridians are more electrical flow, where lymph and blood are more fluid flow. And then you have air flow in your airways, right? So those are the main flows. Like, you could say they're all in some, even, well, and they talk about like your breathing is like a measure of your like life force. So oxygen is equated with life force sometimes. And so these energy flows, PEMF is opening up all of them. And it's kind of giving you, and you can sometimes feel with like the high slew rate, some of the devices have a higher slew rate where you get more induction. You can feel the little tingles. In a similar way, if you have a really good energy healer, you can feel you can kind of feel some tingles with them too. And that's energy moving. I mean, that's life. I mean, so, sickness, and when you're getting close to death, the energy is just stuck. And that's another thing with the biofield that I'm not an expert in, but there's books and good teachers that talk about emotions too. So if your emotions are blocked, that can have all kinds of problems with your biofield, then it can manifest physically. So again, PEMF there can only go so far, but PEMF will help, but you still got to address those traumas and emotions. Although, I mean, because again, PEMF's not going to enlighten you. You have to deal with your stuff, right? Your quote unquote stuff has to still be dealt with. So PEMF's not going to deal with your stuff. Don't think of it as like some magical thing that's going to get rid of all your emotional past traumas and childhood issues and past life issues, whatever. It's going to relax the body. And I've done like rebirthing breathing and stuff. And even like rebirthing breathing, it just gets the energy in there, but you still have to like relive the emotions and the traumas and process that. And that takes consciousness, right? And conscious awareness. So, so I would say PEMF is kind of like that, where it's bringing in the energy that allows you then, if you want to, you can use PEMF in that way. And I've done this at times to kind of process where there's energy blockages, where you can feel there's like emotional components to that. It's not just physical.
In a practical sense, what do you recommend people to do in terms of, so they get a PEMF mat, and I know there are different qualities of PEMF mat in terms of, you mentioned something like dirty electricity, or, love to know about that in terms of quality of PEMF mat, but also what do you generally recommend for people to do? Is it using it once a day, twice a day? How long? Are there specific, frequencies that should be used? What's like the general instruction for people to use this healing technology?
So just to keep it generalized, but it is important to know that there are good, bad, and I mean, when it comes to PEMF, I mean, there's some devices that actually do have dirty electricity. And these, I won't name names, but these are like the ones that have crystals or gemstones in them that claim to have negative ions, crystals, far infrared, PEMF. When you see those four together, just run. You do not want any PEMF device. And I've got 12 of them, so I can say this with a lot of confidence. I've tested them all. And they have measurable dirty electricity in the electric field component. And all they're doing is they're pulsing 60 hertz from the wall, or 50 hertz if you're in another country. And the reason I want to bring this up with your listeners is that when you're in the market, these are the most heavily marketed brands, and people are attracted to them because they're so inexpensive. I mean, they're just cheap. I don't even consider those PEMF, because again, how could it be? You're just taking 60 or 50 hertz from your wall and turning it on and off. So when I do consultations with people, probably half the people that call me are seeing these mats. I wish I could name names, I would, but I won't. But again, the identifier is crystals or gemstones. And it's not because crystals or gemstones are bad. It's just there's no good PEMF device using crystals or gemstones. And the claim of negative ions, for example, is a scam. And I have a negative ion reader. I've measured them. There's 0 negative ions. In fact, I called the manufacturer of this negative ion counter, talked to the guy that designed the machine. He literally had heard so many people asking about negative ions and crystals. he did an experiment himself. He has a PhD in superconductivity. And he found 0 negative ions until you got to 1100 degrees. The only way you can get negative ions out of crystals is getting them to 1100 degrees. And then you get both negative and positive. It's like, oh, you get far infrared negative ions. No, you don't get negative ions. That's a scam. But people kind of latch onto these gimmicks and they think they're getting all this stuff. So that's important. Then on the other end of the spectrum, you have the high intensity systems that make your muscles twitch. To me, that's way too much. Again, the earth is, your muscles don't start twitching when you go out in nature from the earth's magnetic field, right? So I won't get too much into that, but the really good ones that I really like the best are typically in the $3,000 to $4,000 US range.
Do you have recommendations you make regarding the amount of time? What would be like an average time to use?
Oh yeah, prevention or preconditioning is different than if you have an acute injury. Because if you have an injury, like I'll sometimes do an hour, or sometimes 2 hours, even if it's like I really hurt myself. There's no time limit. They make FDA approved devices that you wear like 4 to 8 hours a day, right? For like 3 months, like the bone fracture healing. Because there's many FDA approved PMF devices, again, just to show you how well researched it is. But now for prevention, you can do 8 or 15 minutes twice a day. Like some of the top brands, I won't name names, but some even 8 minutes twice a day. There's 3 of the top brands that their basic protocols are 8 minutes twice a day, just as a general kind of recharge, like just putting your body in a whole body battery charger to recharge your batteries. As the saying goes, it's like, oh yeah, I'm going to take some time off and recharge my batteries, right? Well, you get a little tiny vacation every time you lay on a PMF mat because your batteries do get recharged because your cells are batteries. But if you hurt yourself, then you can definitely do longer and put extra time in. We've even seen great success with cancer. I mean, of course, I have to be careful and say that it's not a curative for cancer, but a lady today this is today's testimonial. I mean, just came in today from Erin. I won't say her last name, but her name is Erin, and she had breast cancer. And after a year of using PMF, one of her big tumors gone. In fact, she said that the lady that was doing the test couldn't believe it, went to the radiologist to say, is something wrong here? Am I doing something wrong? And she's like, wait, no, it was gone. The tumor was gone. And then the other smaller tumor she had shrunk in half. So, but with the cancer protocols, it's also a little more intensive, but it's not hours a day. It's just like maybe upwards to an hour total a day. So there's more, like if you have a serious health issue like that, you'd want to do a little, again, it's not a cure. It's just, it helps the body to heal itself. That's what I tell people. PMF doesn't heal anything. It gives your cells in your body energy. So the innate intelligence, we have this amazing, like the biofield, right? It's this holographic blueprint of perfect health surrounding us all the time. And yes, sometimes it's got kinks and distortions from past traumas and whatever, physical, emotional, but still the blueprint of health is always there. So if we give the body energy, and like PMF can do, then it's like kind of like putting little jumper cables on your 37 trillion cells. It just kind of jump starts the healing process, and then the body can just heal itself. So I really do believe that all the best energy medicine devices don't heal. They help to give your body like a little jump start, a little to help so the body can heal itself. And sometimes that jump start comes in the way of increasing energy and electrical flows. Because again, like energy healers, if you're, when you lay on PMF, if you're subtle to sensitive, if you're sensitive to subtle energies, like if you meditate a lot or practice like Tai Chi or Qigong, those people almost always feel the PMF, because it's just like these very gentle, subtle current flows you can feel, like just little relaxing tingles up and down your body. Now, some people are a little more like blocks of wood. They don't always feel it. So it's about half and half. Some people say, I don't feel anything. Is this working? It's like, yeah, it's working. You're just not feeling it. But that's because it's like a magnet, right? Like if you put a refrigerator magnet in your hand, you don't typically feel the magnetic field there, right? I mean, you can if you're very sensitive. But so yeah, I would say anywhere from 8 minutes twice a day to upwards. I mean, I've used it upwards to 6 hours in one acute situation. But and it is a great preconditioning tool. So it can make your cells more resilient and stronger. And actually, again, through well-known NFR2 pathways, where it stimulates all those antioxidants in your cells, like superoxide dismutase and glutathione, peroxidase, catalase. These are all natural antioxidants in your cells, not taking supplemental. So by increasing the resiliency, you are less likely to get hurt if you do fall down and do something dumb. Like maybe, I use PEMF every day. Maybe even if I hurt myself, maybe it would have been worse had I not been doing PEMF. And I really believe that it would be worse in some cases, right? So, so yes, it increases your resiliency. So even if you're healthy, I still tell people to get a PEMF device because it'll help keep you healthy. And if you do have a car accident or something happens, you're going to recover faster and you're going to get less hurt because your body's going to be stronger.
So the PMF is really an emerging technology. We're seeing a lot of increase in awareness of this. It's popping up in mainstream wellness practice now. It's not sort of off in the corner. What do you think the future of PMF sort of in healthcare might look like? Will it sort of move into the mainstream more and more fully? And how is it that people might be engaging with these technologies going forward?
Yeah, that's my vision. It's the medicine of the future. And I think it's just the hurdle is just big pharma, big medicine, all the politics of drugs and pharmaceuticals, because it's such a big industry, right? So, but PMF is FDA approved for depression. Neurostar, the transcranial magnetic stimulation devices, are replacing the electroshock type of therapies, which are not very humane, but they did work, right? But PMF is just a gentler way to do that. But it really all started with the non-union fractures, how PMF stimulated bone. So they're already using these devices at orthopedic surgeons. And I had a lady that had like some surgery on her neck, and her orthopedic surgeon sent her home with a little PMF necklace to wear 4 to 6 hours a day. So and again, I think it's going to become more and more prevalent. And I tell people, vote with your dollars. I mean, if we demand holistic, non-invasive, non-addictive modalities to heal ourselves, then the big powers that be are going to be forced to kind of give people what they need. But it kind of takes a little bit of like disconnecting from over-reliance on pharmaceutical drugs. And there's so many, again, I'm not a medical doctor. I'm not going to give medical advice, and don't get me wrong, when you're in a certain severe state, you might need like medical intervention. But so I think as people demand, it's really, because again, the big pharma companies are going to keep selling drugs if we just keep allowing that to happen. But as people are looking for alternatives because they're frustrated with the lack of results from medicine, at least for chronic, I'm certainly emergency care, it's good, but for like chronic things like cancer, heart disease, there's just the war on cancer is a failure. Cancer rates are as high as ever. I mean, so it's because they're missing the energetic component. Inflammation is highly energetic too. So it's like they're cutting out the biofield from medicine. And I think I'm hopeful, I'm optimistic that things will change, and that maybe better politics will arise. And I think it's just inevitable at some point. The tide will just there'll be so much momentum. It'll be a turning point. And I think right now we're not at the turning point yet, but I think in coming couple decades that we're going to hit that turning point. Then it's just going to shoot. And I think energy medicine will, my prediction, will replace a lot of conventional medical approaches, but not 100%. If you got a broken bone, you still need it to be set. If you're in a car accident, you still need emergency trauma care, right? So I'm not saying it's going to go away. I'm just saying that there's so many things that energy medicine can do that modern medicine can't do well, right?
If people want to find your work, look more into what services you offer, how can they do that?
Yeah, so just put it's bryantmeyers.com, which is just a very crude website right now, but it gives you my phone number and my email are like right there. So you can call me. I do offer, if you're in the market, I just ask that you're in the market for a PMF device. I mean, if you already have one, try to get back to the person that sold it to you to get training on that, right? I can't train everybody that's bought a machine. But if you're in the market and you're looking for one, call me and I offer a free consultation. Maybe you can put a link in the description.
Absolutely. We'll have a link to that in the show notes. It's been an absolute pleasure to connect. Thank you for sharing something of your knowledge and wisdom. I feel like we just touched the tip of the iceberg, but it's such an important and emerging area, and it's been a pleasure to cover it with you. Thanks for being a part of the Future of Wellness. Be sure to subscribe and leave a review. It helps us reach more people and to make great episodes like this one. Learn more about field dynamics and why we think the future of wellness matters. Check us out at energyfielddynamics.com. See you next time.